Cooper. Today we will be doing an ankle assessment using hops, and the first part is the H, so we will just ask about the history. We'll ask how did the injury happen, when did the injury happen, where did the injury happen, on what side of the ankle does it hurt, how badly does it hurt, whether or not they can apply pressure to the foot, if they iced the ankle afterwards, if they continued playing afterwards, if they heard anything pop and if it affects the way that they walk, and if they have had any surgeries prior. Then we go into the O, which is observation, so we will look at the patient standing, the anterior view to observe alignment of the toes and position of foot in relation to the limb. Then we'll go to the medial view, inspect for a high arch, flat foot, or excessive prominence of medial midfoot. Then we go to lateral view, inspect for ankle swelling or prominence of posterior calcaneus. Then the posterior view for assessing alignment, which should be neutral or slight valgus, which is turned out. Then we go into standing on the toes. The heels should be moved onto varus, turned in position. Then we go into galt, which is equal stride length, foot position, and weight distribution. The foot should be within 0 to 20 degrees of external rotation when walking. Then we'll look at it when they are laying supine. So from the anterior view, we will observe the toenails and look for bunions, hammer toes, claw toes, and the ability to spread toes and look for ulcers between the toes. Spread your toes. Then the patient will lay on their stomach and will look at the plantar surface and observe for plantar warts, calluses, or ulcerations. Then we go into the P part of hops, which is palpation. And first we're going to start with the medial and lateral malleolus. So we're going to palpate the area of the tibial nerve, posterior and inferior to the medial malleolus. And then we're going to check for the posterior heel, palpate both sides of the Achilles tendon to identify swelling or tenderness. Then the peroneal tendons, so invert your foot, or evert your foot. Evert? Yeah. And then we're going to palpate the posterior and inferior to lateral malleolus for tenderness or swelling. Then he's going to invert his foot to check for their anterior ankle, which is palpating along the talofibular ligament and calcaneofibular ligament for tenderness. Then we're going to do plantar fascia, and we're going to palpate the plantar fascia for tenderness or swelling, so underneath the foot. Then the sesamoid for palpating the area beneath the first MT head for tenderness, so just beneath the first toe. And then the MTP joint, so we're going to palpate each of the toes to see if there's any pain or tenderness. Next is range of motion. So first we do dorsiflexion, which should be 15 to 20 degrees. Then we do plantar flexion, which should be 40 to 50 degrees. Inversion, 25 to 35 degrees. Eversion, 20 to 25 degrees. Okay, next we check for muscle testing. So first we're going to do posterior tibialis, and the foot will be in plantar flexion, and we're going to resist the inversion. Next is the anterior tibialis. The foot will be in plantar flexion, and we're going to resist the inversion and dorsiflexion of the foot. Then we're going to do the peroneus longus and brevis, and the foot will be in plantar flexion, but we are going to resist the eversion of the foot. Then it is the extensor hallucis longus and extensors, and we are going to check to see if they can extend their great toe. Alright, good job. And then we're going to do the flexor hallucis longus and flexors, and the ankle will be in neutral just like the last one, but we're going to see if they can flex their great toe. And then the gastrocnemius, the ankle will be in dorsiflexion, and we're going to resist the urge to plantar flex. Finally, we will be going into the S of hops, which is special testing. So first we will do the anterior drawer test. Looks good. The apprehension test, and we are going to have the foot plantar flex and invert the foot. Then the varus stress test, which is kind of the same thing, but we're just going to invert the foot. And then the valgus stress test, we are going to evert the foot. And then the MTP instability, we're just going to dorsiflex and plantar flex their great toe. And for the interdigital neuroma test, we're going to apply upward pressure of the toes and just to check to see if they have any Morton's neuromas. and he's good. Thanks for watching my ankle assessment. Thanks to Brennan.